Now in the second section of our lecture, let's talk about the normal labor. And when we will talk about the normal labor, the most important is what are the stages of the normal labor and how we can manage the normal labor and what's the partogram. Stages of the labor, there are 3 stages of the labor. In the first stage, usually we have the uterine contraction begins, and there is a beginning of the dilation of the cervix in the first stage. Then in the second stage, there is cervix dilation is complete and the baby is delivered. Then in the third stage, the placenta is delivered. So the stages, first stage, starts with onset of regular contraction and cervical changes. So once the regular contraction, once the true contractions, true labor begins with the regular contractions of the uterus. This is the beginning of the first stage, and with these contractions of the uterus, the changes in the cervix begins, and it causes slowly the dilation of the cervix. 2 phases. First stage of labor consists of 2 phases. We have early latent phase and then the active phase. Early latent phase and active phase. Then the second stage of labor, we have duration from full cervical dilation to delivery of fetus. So in the first stage, the contractions begin and changes in the cervix begin with the uterine contraction. Consist of 2 phases. We have early latent phase and then we have active phase. Then in the second stage of labor, once the cervix is fully dilated and then the baby is delivered, this make up the second stage of the labor. Again, it has 2 phases, pelvic or passive phase and then the active phase. Then in the third stage of the labor, there is from the delivery of the baby to the delivery of placenta and membranes. So all these constitute the stages of the labor. There are 3 stages of the labor. In the first, there is beginning of the uterine contraction and changes in the cervix. Then the cervix is fully dilated and then the baby is delivered. And after the delivery of the baby, in the third stage, delivery of placenta and the membranes occur. So these 3 stages constitute the normal labor. Third stage of the labor. Here, if you see third stage, which is the separation of the placenta from the wall of the uterus, and then the delivery of placenta and the cord here. So complete expulsion of the baby, uterine muscle contraction. So after the expulsion of the baby, the uterus contract, and this causes separation of the placenta from the wall of the uterus, and then it comes out very easily. The cord is in the hands of the obstetrician or the nurse, and then slowly it comes out. So this is the contraction of the uterus, expel the placenta and the cord out of the uterus. Shearing of the placenta, pushing it into lower segment and vault of vagina. So contraction of the uterus causes shearing of the placenta and it pushes it to the lower segment from where it is removed, and this is the uterus after the delivery or removal of the placenta and the membrane. This is the placenta attached to the wall of the uterus. Now with the contraction of the uterus, it is pushed down into the lower segment and then it is expelled. Delivery of placenta and membrane. So this third stage is mainly delivery of the placenta and the membranes. Any pieces of placenta, if left behind, it is very important that attention should be paid to if the placenta is completely removed or not, because if the pieces of placenta are retained in the uterus, this can cause a problem and there will be bleeding after the delivery. So it's very important that attention should be paid that placenta is removed in whole. The onset of labor. The clinical signs of the onset of the labor are regular and painful contractions. So beginning of the regular contractions of the uterus, regular and painful, is the beginning first sign of the onset of the labor. Passage of blood stained with mucus from cervix, this is called the Shaw. Shaw is the mucus mixed with blood. This is the indication that the uterus is contracting, and painful regular contraction cause the bleeding, and this blood which is mixed with the mucus is known as the bloody Shaw or the Shaw. Rupture of fetal membrane or without uterine contraction. So can be without the rupture of the membrane or without regular contractions. PROM is the term used for pre-labor rupture of membrane, and PRROM is the preterm pre-labor rupture of membranes. So these are two terms used. PROM is pre-labor rupture of membrane, and PRROM is preterm pre-labor rupture of membranes. Mechanism of labor. Few steps are important for the normal mechanism of labor. How the baby, what are the different positions achieved by the baby which leads to the final expulsion of the baby from the uterus. So first is there is descent of the baby. Baby comes down, there is a descent, and then once the head is felt through the on pelvic examination, after the cervix is dilated, this is the descent. So baby is moved down, descent of the baby. Then there is flexion. So after the descent, the baby bends and it gets the flexed position here. After flexion, then there is internal rotation of the baby. Here you can see this is the descent of the fetus. Then the flexion of the baby. Then internal rotation. Now it's turn internally. Internal rotation occurs. Then there is extension. Head is extended back. Extension. This is the extension. Then after extension, there is restitution, means the come back to normal position again. So hyperextended or extension now comes back to normal, restitution. And then after that, there is external rotation. Once it's internally rotated, then it is rotated externally, and then shoulder is delivered and delivery of shoulder occurs. So these are all the steps that that makes up the normal mechanism of labor. So there is descent, flexion. After the flexion, internal rotation, just to turn it little internally, and then after internal rotation, there is extension. The head is extended, restitution, coming back to less extension or bringing the head back. Then there is external rotation and delivery of the shoulder. So this is the mechanism of labor. Management of normal labor. Examination at commencement of labor. So examination should be performed at the beginning of labor. Following examination should be performed. Full general examination, and in the general examination we should do the pulse, respiration, blood pressure, and what's the hydration state of the patient. Tests for glucose, ketone bodies, and protein should be performed. Then the obstetrical examination of abdomen and inspecting fetal lie, presentation, and position, it's important. And then auscultation of fetal heartbeat should be performed. So at the beginning of the labor, we should do the general examination and obstetrical examination, and we should do the fetal heart rate monitoring, and then also the position and presentation of the fetus. Then vaginal examination after cleaning of the vulva and introitus. It's important that we should do the vaginal examination, and in the vaginal examination we should find out the position, consistency, effacement of cervix, and dilation of the cervix. Also whether the membranes are intact or ruptured, and what's the color and quantity of amniotic fluid. Fetal presentation, whether it's vortex or breech, and position, if it's left occipito anterior, right occipito anterior, or right occipito posterior. And then assessment of the bony pelvis. So all these examinations are important at the commencement of the labor. One is general examination, then we should do the examination through abdomen, and then also the pelvic examination. These two fingers are used for the pelvic examination to assess what if the changes of the cervix are taking place, how big is the cervix, how much dilation of the cervix occur, what's the effacement of the effacement is the thinning of the cervix. It becomes effaced and then soft, and then it starts dilating. So we should look for that. We should look for the fetal presentation, whether it's head is coming first or the it's breech, whether the membranes are intact or not. So all these are very important assessments at the beginning of the labor. Principles in management of first stage of labor. First stage of labor, I mentioned already, is from the beginning of the regular painful contractions of the uterus and the dilation of the cervix. These regular painful contractions causes changes in the cervix. So that's very important. So stage 1, this is the initial latent phase of the stage 1, then the active stage when the cervix is effaced, and then the effacement of the cervix occur, and then also there is slowly beginning of the descent of the fetus. So observation of labor progress and intervention. Monitoring fetal and maternal condition in the first stage is important. And then pain relief during labor and emotional support for mother. So it's important, if pain is too much unbearable, we should try to help and give emotional support to the mother also in the first stage of the labor. Adequate hydration and nutrition throughout labor is important. Then the partogram. Partogram is a single sheet of paper on which there is graphic representation of progress in labor. So partogram is the paper on which the progress of the labor is monitored. All the steps of the labor, the time, how long is the labor, contractions of the uterus, assessment of the baby, all that is monitored with the help of the partogram. Has various sections to enter frequency, blood pressure and temperature, etc. Fetal condition charted as beats per minute. This is the partogram, a single sheet. There is graphic representation of progress in labor. So we have different, this is the fetal heart rate, how the heart rate is accelerating and decelerating. This is the fetal heart rate. Then we have XT is the cervix, and then O is here is the descent of the baby. This is the dilation of the cervix or the changes of the cervix, and with the changes of the cervix, descent of the fetus. Then duration of labor in hours, how long is the labor, and then if oxytocin is given, how many drops per minute. So all this is graphic representation of the progress of the labor. Then also it gives the contraction for 10 minutes of the uterine contractions here. Drugs and IV fluids given during the labor, blood pressure and pulse recorded here, and then we should get the urine, protein, acetone, glucose level and temperature. So again, it's a single sheet that gives all the tracings, all the recordings on one sheet, and this all tells us the progress of the labor, condition of the mother, hydration of the mother, and the urine condition, if how much is the protein, acetone and glucose in the urine. So this is the partogram. Progress in labor, measured by assessing rate of cervical dilation and descent of presenting part, assessed by vaginal examination. Cervicograph is used to look for the dilation of the cervix, alert line and action line. Here we have, this is the active phase, and this is the latent phase, and then we have the alert line and action line, how it is progressing. So this is the progress of the labor, how big is the cervix, if it is 10 centimeter, and how long it is taking, or how long is the progress of the labor. So that was all about section 2, in which we talked about the normal labor and its management. Thank you for watching sqadia.com.